Let's talk about why your back feels tight after exercise and can often feel tighter after you do ab work. Now, I am not going to be diving into nerve and disc issues here. We're simply going to be talking about tension in those low back paraspinal muscles and why that sometimes ramps up after exercise when you just want to feel your abs working. So the first thing we're going to dive into is why this happens. Then we're going to take a look at some very helpful exercises to get your back muscles to let go and relax. And then we're going to be looking at how you can modify your ab work to get more abs and less back muscle. So let's take a look at those paraspinal muscles. So they run all the way from your pelvis and your spine all the way up the length of your back. Now, when we think about these muscles, they are going to have an anterior pull effect. So when those back muscles are tight, they are going to be tipping and pulling your pelvis forward. And this is when you feel your back and you're like, oh, I feel these big ropey muscles. They feel tight. Now, one way to combat this is you can use your hamstrings that pull down and help to anchor your pelvis, thus getting these back muscles to help relax and help them let go. Now, you can sometimes get in a tug of war where the hamstrings are pulling down, the back muscles are pulling up, and then the hamstrings and the back muscles feel tight, which is then where we're going to need to get more pieces of the puzzle involved. I like to think about it as thinking in layers. So we are essentially peeling back layers on what is creating this tension and also what is continuing to perpetuate this tension. So we're really going to want to think about this in layers. So not one thing that I suggest today might be the thing, but it might. But what we're going to do is we're going to break down multiple things. So it might be a combination of putting all those things together that then gives you lots of back relief. So one thing we're going to be doing today is finding those proximal hamstrings to help release those back muscles. The other reason those paraspinals will often tend to kick in and work a lot is I see them working for exhales, like when you breathe out. So a lot of times people will exhale forcefully from their back muscles, okay? So try it with me now. Go ahead and take your hand, take your thumb, and place it on your back muscles. How does it feel? Is it soft and squishy? Mine feel pretty soft and squishy if I push in here. All right, so are they soft and squishy? Now what I want you to do is give me a nice soft exhale. Keep feeling underneath your finger. Do you feel anything contract underneath your finger? Now, if you're like, Sarah, I can't even get my back muscles to relax just right now sitting here, find a chair, like a recliner, and sit back into it and just really relax back into that chair, or even lie down on the ground. And side lying can be very helpful, and see if you can get your back muscles to relax there. So find that position where you can get them to relax. And then what I want you to do is start with a nice low breath and seeing what happens. Do they kick in? And then I want you to start with a more forceful breath. Blow hard. Do they kick in then? I feel no change in my paraspinal muscles when I blow out hard here. And the thing is I found that people with those perpetual back tightness where they're like, I just can't seem to get my back to loosen up, they will often recruit those paraspinal muscles for their forced exhale. What do we do during exercise? We breathe hard, right? So it's no wonder the low back always feels tight after exercise, because you're like, I'm breathing hard to really do this tough exercise. And the paraspinals are like, you use me to breathe. If you would stop using me to breathe, I could actually calm down a little bit. Now, if we're not using our paraspinals to breathe, what should we be using? Well, step number one is we've got to get really good diaphragm motion for that inhale. So if your diaphragm comes down really well for your inhale all around, then we get more of that recoil of the diaphragm for our exhale, assisting that exhale. So what I want you to do now, we're going to just be breaking this down into lots of steps. What I want you to do now is take your hand and place it on your low back, find your rib cage, go right below your rib cage, and I want you to give me a nice big inhale into your hand, okay? Did you feel an expansion into your hand? Did you feel this move? That is back diaphragm expansion, posterior diaphragm expansion, and that is telling those paraspinals, hey, take a breather. All puns intended there. So it's telling those muscles to take a break. So you've got to get that nice diaphragm expansion in the back. Now, since we know the paraspinals want to fire for the exhale, okay? So if they are helping us too much for that exhale, sometimes they help with inhales too, which is not good. So when we think about those layers, that's where those layers come in. So I'll see more commonly people will use their paraspinals to help with their exhales, but if somebody's really got a lot of back tightness, they're going to be using a lot of paraspinal to help with that inhale as well, which sometimes maybe if we're in a really extreme, heavy, really need to breathe heavy situation, it's okay. But especially for normal breathing, those paraspinals should not be kicking in. They should be staying soft and squishy for a nice, normal breathing inhale. So what should be working to help us more with our inhales and exhales? Well, our intercostal muscles. So you have little muscles that sit between, well, they're actually not that little, but you have muscles that sit between each of your ribs. And those are muscles that help us generate force with our inhale and force with our exhale. So when we think about where we want that force to come from our exhale, we want it to come from those internal intercostals for that exhale. So when we think about that nice big exhale, you should be able to get a lot of rib motion for both your inhale. Think about that as intercostals pulling the ribs open, and exhale, thinking about those internal intercostals pushing those ribs closed. So we're getting lots of intercostals, and oftentimes when people start really doing great deep breathing, they will sometimes get cramping between their ribs. They'll be like, oh, I really feel that for the first time. Things feel a little tighter, a little crampy, and like, yay, you found your intercostal muscles. So really recruiting those intercostals, and then secondary, what's happening with your abs. Okay, so that would be the next step. Now, breathing, much more important for us to get those intercostals, because if we get too much of those external obliques, especially when it comes to that exhale, with a tendency to have a lower belly pooch, put too much pressure down on the pelvic floor. But when we think about those low abs in particular, our lower abdominals help us pull into a posterior tilt. Now, what happens when our paraspinals are tight? They pull us forward. So when we get more lower ab recruitment, so we're thinking more of those deeper lower TAs, we're thinking more internal obliques, we're thinking more external obliques down here, we are gonna get more posterior tilt. Think about that as assisting hamstrings, so you're not all hamstrings, but then also taking some of the force off of those paraspinals. So let's take a look at an exercise to help us with getting more of those lower abs as well. So we're going to want to work this where we actively find those hamstrings, the proximal hamstrings, and then we actively get a better breathing, helping to expand into our back, release those paraspinals a little bit more. And then we want to get really active breathing where we get a little force and a little oomph behind those exhales while keeping those paraspinals as calm and quiet as we can. So we're going to want to really pull in hamstring and lower abs for that. So let's dive into a couple helpful exercises now to really help put this into practice and application. Okay, so go ahead and find a nice comfy spot on the floor. Find something to put your legs on. Lay in front of a chair, a couch. This is a version of the PRI 90-90 exercise, and it's a really good way to help get those proximal hamstrings kicking in. So what I want you to do is just relax your legs on the chair or couch. If you want, you can put your feet against the back of the couch to help give you some reference. I just find when people are starting out with this exercise, if they try to push on a wall, then they're going to get a lot of quads, or they often get a lot of quads. If they're dealing with really tight paraspinals and more of a quad dominant pattern, then hip flexors are going to kick in, their TFLs are going to pop out, and they're going to have a lot of tension in their quads. So just simply pulling down on a chair or a couch or something is going to be really helpful for just getting those proximal hamstrings. So what you're thinking about here is you're thinking about these hamstrings inserting here, and they're pulling up on the bottom of the pelvis. So what you don't want to see here is a lot of knee drive without changes in the pelvis, because then that's telling us you're getting distal hamstring instead of proximal hamstring. Okay, so what we want to see is minimal knee movement up, but a lot of pelvis movement. Okay, so can you see that difference? This is lifting with distal hamstring, and this is lifting with proximal hamstring. So see how I got minimal knee drive when I worked proximal hamstring, but I got a lot of pelvis movement. So this is a lot of proximal hamstring, and this is a lot of distal hamstring. So what you want to think about is a lot of pelvis tucking here, and you want to feel some tension back here. If you feel that ischial tuberosity and then you go right above it, you should feel a lot of tension in those hamstrings. The other thing you should feel is squishy glutes and squishy TFL, okay, and squishy quads. So all of this is squishy, 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 except for those proximal hamstrings. You can hold here, you can breathe. Just be sure that you're not feeling a lot of tension in your back. You don't want to fight this. You want to keep the movement small. You can start with really big, kind of longer isometric holds, just to really get a feel of it. And you're not really lifting and tucking a ton, okay? It's just a small movement, not a lot of lumbar flexion, just more proximal hamstring activation. Next, you're going to ditch the chair and we're going to go into a little bit more passive motion to really work on breathing more. Then we're going to turn it into, hey, active, let's get some work done. So what I want you to do now is flip over into child's pose. Full squat is also really great for this, but let's go ahead and just start with child's pose. So go ahead and flip over into child's pose, and I want you to sit down. And if you have a pillow or towel roll, something a lot larger than this, but I'm gonna start with this. I'm gonna place it right on the bottom of my rib cage so that it kind of helps give me a little extra kind of rib compression. And then what I'm gonna do here is sink my head down, however I can make that comfy. You can also put a block underneath your head. And then you can take your hands and place them on your back and feel those paraspinals. Now I want you to give me a nice inhale. Focus on inhaling into your hands. Relax on the exhale. Sink deeper with the exhale. Inhale into your hands. Feel that expansion of your breath back here. Relax on that inhale. Relax on that exhale. Inhale into your hands. Feel that expansion. Relax it on your exhale. Okay, so this is where I would start, with that nice little really getting a good stretch for this inhale. The more you kind of fluff underneath here with pillow rolls or towels, the more you're going to get more like a little bit more of an aggressive stretch on that inhale in this child's pose position. So I would start there. Then we can make it active. If you find a wall for your feet, you can place your feet on the wall, and then you can create a hamstring drag. So remember how we found those proximal hamstrings on the chair? So what you're gonna do now is you're dragging up on the wall with your hamstrings, and you're gonna pull down. Glutes are squishy, pull down with those hamstrings, and then you're gonna think about relaxing down between your shoulder blades. And then I want you to find your hamstrings and then kind of follow your hamstrings up a little bit. So you're not curving, you are more bringing your rib cage up, kind of more of a flattening, compressing effect on the rib cage, not curving through that thoracic spine a lot. Okay, so lead with the hamstrings, follow a little bit with the rib cage, remember, not a dramatic curve, and then you want to hold here, inhale into your back, exhale from rib cage compressing in, and then abs creating some tension. Now, if you can, place a hand on your low back. Feel those paraspinals for this. If you are not strong enough to let go of a hand, you work on the serratus and triceps if you're not strong enough to do that, but get a friend to help you, all right? Get somebody you're working with to help you with checking your paraspinals to see if your paraspinals are tight. All right, so go ahead and give me a couple of these breaths and just see how that feels. So find those hamstrings, follow those hamstrings up a little bit with a little bit of rounding. Inhale into your back. Feel that expansion. Exhale, rib cage comes in, flattening for that exhale, and abs kick in for that exhale. Paraspinals stay soft and squishy. So somebody who's feeling your back should not feel an increase in tension in those back muscles. And you can create a really great exhale there. And then you can take that, you can add a balloon, you can make it much harder with increasing that resistance, and then step by step, that's how you'll get those paraspinals to let go when you're doing higher demand exercises with breathing. Now I wanted to leave you one last tip for ab work. So when doing things like dead bugs, grab a towel roll. Now whether or not you have more of a high hinge point or more of an anterior tilt, so check out your back when you lie on the ground and see kind of where you have the most curved spot. So wherever you have that most curved spot, take that small towel roll, place it under that most curved spot, kind of exhale down into that towel roll. The size of the towel roll will depend on kind of how much of that curve is shoved forward. So you're bringing the ground up to meet the curve of your spine, which is then going to create less rectus, and then that will be less tug of war with those paraspinals. So having something to press into allows for more TAs because it's more that you're bracing into that towel with a little bit of a posterior pelvic tilt instead of really going into a big posterior pelvic tilt, which will be more rectus. So then you can go into your dead bugs, you can do your ab work like that, using that towel roll as that reference to help keep those paraspinals nice and quiet. Okay, so try all those tips and hopefully something in there will help with calming down overactive paraspinals.